can we go swiftly over to Becky, please?
Thank you, Chair, and thank you for coming along today, Secretary of State Sally and Sir Jim. If we can move on to population and public health, please. So if we continue your theme, Secretary of State, about money talking, could you please outline to the committee how the finances are going to align with your sickness to prevention shift? And specifically, in 10 years' time, what percentage change should we expect to see in these areas?
Oh, I'm definitely not going to write the budget for 10 years down the line.
But would we expect to see a change, Secretary of State, in terms of the shift from sickness to prevention and the money following it?
Yeah, and look, over time, what we want to do is see far less spent on the price of failure. And, obesity costs the NHS 7.3 billion a year, alcohol 4.9 billion a year, tobacco still, despite all the progress we've made, 1.9 billion. Economic inactivity due to sickness. In the NHS, 2 billion cost to the economy. So you can see sort of right across the board we're paying a very high price for failure. What we've set out in the plan are a number of approaches, some of which you would consider a sort of conventional public health, and obviously we've got the tobacco and vapes bill going through Parliament, which, in terms of the impact and benefit of the policy, would provide the NHS with £6.6 billion worth of savings, and we're going to go further by clamping down on vaping of young people. But then there are kind of more radical approaches. So what we're proposing is to do with supermarkets, for example, to improve the nutritional value of the average shop. I don't think has been tried anywhere else in the world. The genesis of the policy was an idea from Nesta, who we've worked with to develop that policy. We've got a number of the big supermarkets on board. And taking that approach will lead to a very different sort of approach, not just from the state, but from the food and drink industry as well.
OK, Secretary of State, so perhaps we'll go straight to that then. So a voluntary arrangement with large food companies has been tried before under the previous administration. Prime Minister Cameron tried this and yielded very poor results. In fact, the only evidence-based increase really was around the legislative food tax. So how is this voluntary agreement going to be different to previous voluntary agreements?
Well, the reporting and the target would be mandatory. We want to work with the industry to get it right. So it's not in any of our interests for it to fail. But the data on the food and the drink that we buy from supermarkets is already held by them. It's some of the best public health data in the world. They had already been calling on us to publish the data, and so that's the bit we should look to do with them most quickly. But then I think we should work with the industry to set a target for improving the nutritional value of the average trolley or basket.
OK, and I agree, the public health data are good, but I'm sure that you're aware that in terms of socioeconomically deprived areas, there is a substantive number of our population who do not access their food and their nutrition through supermarkets, and therefore how is this particular initiative going to address those inequalities? And if it's not, how are you looking at the nutrition of people who are in what we call food deserts, where they're accessing their foods through smaller shops, etc.?
So 85% of our shops come from supermarkets. I take the point you're making about the exceptions and some of the areas of the highest levels of deprivation. But I don't think we should let perfect be the enemy of the good. I
agree, Secretary of State, but in terms of proportionate universalism, if you were going to put your investment into a place that would make a substantive difference, would you not agree that you would put it into the most deprived areas to see that improvement, which I think actually is your aim in your 10-year strategy?
Yeah, and that's why in a speech in Blackpool recently I announced our determination to change our funding formula for investment in public health to target those areas of highest level of need and deprivation. We'll be taking a similar approach to reform of the Cahill formula for general practice. I think it's a disgrace, frankly, that if you are living in the poorest community in the country, there'll be about 300 more patients per head than the most affluent, so it's the inverse care law, like writ large. But the supermarkets thing is significant because by setting the target in the way that we will and actually giving industry the freedom to innovate, I think we will see things like loss leaders and price promotions on the healthiest products. I think we will see supermarkets thinking more creatively and ethically about their marketing practices, the layouts of their shops, and the wonderful thing about this approach we're proposing, if we get it right, is actually it will lead to less nanny statism, ironically, because rather than having the Secretary of State trying to dictate price points, promotions, location of the chocolate in the supermarkets and anything else that I might be tempted to meddle in to make the nation healthier, if supermarkets are driving towards the goal of more nutritious sales, they will know their customers best. They will know what works well in terms of nudging people in the right direction, and that's why I think this sort of partnership approach, I think, is I think the third way between kind of nanny statism on one hand and being very directional, or kind of just taking a step back and being completely laissez-faire about it.
Okay, so I look forward to seeing how the choice architecture improves our lives. The data so far don't back it up, but I very much hope that you're correct. Can I go to something that perhaps is more directional, which is alcohol, which you mentioned the cost of alcohol to the National Health Service and to people's lives. So could I ask why in this 10-year strategy we are not making a commitment to set a minimum unit price when the available evidence shows that this is an effective way of reducing harmful alcohol intake?
Minimum unit pricing, I know that there is a loud campaign in favour of minimum unit pricing. That's not something the government has chosen to proceed with at this time. I'm sure there'll be a healthy debate on that in Parliament. What we are proposing to do is give the consumer more health information. It is a bit daft that you can, get more nutritional information about a can of fizzy drink or a packet of crisps on the shelf in the supermarket, but when it comes to the number of calories in a pint versus a gin and tonic or a gin and slim versus a glass of wine, we don't make that information available to consumers, and I think we really ought to. We do need to go further on tackling what I would describe as problem drinking. 4% of people drink as much as 30% of the alcohol consumed each year, and they do that at serious consequences to their own health and sometimes to the detriment of their own lives. And that is the issue I think we need to, with the whole sector, have a more focused approach to tackling.
Okay, so I look forward to that robust debate on minimum unit pricing. Perhaps moving on to something else that is also in our legislative agenda, which is the junk food advertising ban before the watershed. Could you explain why that's being delayed, please?
Well, it's still it's coming in from the new year. There were perfectly reasonable, legitimate concerns about going as fast as we were proposing to. Sorry,
Secretary of State, what were they?
The readiness of the industry to comply and the way in which the regulations would be subject to potentially misinterpretation. So I think it's fair to say the industry, they know it's coming. It's definitely happening. There's no wriggling out of it. And actually what you'll see in the run-up to Christmas is widespread compliance. But there was I think a reasonable debate about brand advertising versus product advertising, and we wanted to work with people through those issues so that the law actually works in practice rather than catches people up with laws of unintended consequences. So that's the only reason for that delay, but you should still see widespread compliance.
Okay, and just to explain, if you can, around the branding issue, so is the conversation that you can't show the product per se, so the food product, but the argument from the industry is that they should be allowed to advertise their brand? Is that the argument that's going on?
In a nutshell.
Okay, and do you have a sense about where that's going to land yet or not?
We'll keep you updated.
Okay, thank you. And my final question is around the health mission. So obviously the National Health Service, it's great that it's going to be a National Health Service again, but I know that you're all too aware that health in and of itself is it should be a mission across all the directorates and into local authorities. So I just wanted to ask, it's gone quite quiet. Is the health mission still alive? And if so, how is it shaping the broader health prevention agenda with this 10-year strategy? And if it's, died a death, who and how is now are now shaping this very important issue across the relevant directorates?
No, look, it's still very much alive, and one of the things that is working really well in the health mission is the way in which we're firstly galvanising other government departments behind the focus on public health and prevention. So on this policy I mentioned on supermarkets, for example, would not have been possible without the joint working between my department and DEFRA and the support of Steve Reed, the Environment Secretary. Similarly, the work that Lisa Nandy is doing to try and reorientate our cultural and sporting offer to underserved working class communities with high levels of deprivation need across the country, very much aligned with the health mission. Bridget Phillipson's work on not just expanding free school meals and breakfast clubs, but making sure they are nutritional, and the work that we're doing in partnership with DFE and DCMS on school sports and making sure we've got qualified PE teachers, upskilling education on PE and games in our schools, all really important stuff. And there's a whole load of stuff just like that that's coming together under the health mission. But we're also looking,
is housing and air quality, are they there and live?
Yeah, look, one of the things that is exciting about the Deputy Prime Minister's commitment to build 1.5 million new homes is that one of the biggest challenges we see are the number of children living in temporary bed and breakfast accommodation, not able to have decent space to live and learn and play, often in accommodation that doesn't even have basic cooking facilities, and so the takeaway is the only option. All of those things, all of the social determinants of ill health, that is what we as a government are committed to tackling. And moreover, we can't do this as government alone. We need to work with business and civil society, the private sector and the voluntary sector, to bring all of this to life, and that's exactly what we're doing. The supermarkets policy is a good example of working with the private sector. We've got an exciting collaboration which is coming out tomorrow to get more young people kind of physically active and engaged to tackle the issue of obesity amongst primary age children. So you can expect much more of this sort of stuff coming out of government in partnership with business and civil society.
Great. And just to say that obviously the public health workforce is a key part of this. I appreciate that they don't sit all in the national health system. They sit in local authorities and in different places. I note that there's not a specific plan around the public health workforce per se yet, so presumably will that be looked at in partnership with local authorities?
Yeah, I very much see, especially as a former Cabinet Minister for Health and Wellbeing and Local Government, I very much see DPHs and the public health team as part of our team. And we're improving all the time the relationship between my department and Directors of Adult Social Services and Directors of Public Health, as well as elected members as well. And one of the things what I'm committed to doing with the LGA is, as part of the delivery of the 10-year plan, making sure that we've got much stronger institutional relationships, not just between Whitehall and communities across the country, but also across communities between the NHS, local government, and social care and the voluntary sector as well.